I'm very excited that I get to welcome Dr. Nora Volkow to our National Leadership Conference. We are huge fans of Dr. Volkow here at Addiction Policy Forum. We do our best to try to translate and push out as much of the science and the innovation and the discovery that Nora and her team really help make possible for SUD and make sure that's accessible to our patient and family community. And Nora, we are so grateful that you took time to be with us today to give us an update from NIDA. As a quick recap, we have over 800 of our network folks that are joining us for our two-day conference. Our network includes patients, families, practitioners, professionals, whether they're in the treatment field as providers, recovery services, criminal justice professionals, grassroots organizations, preventionists, you name it. We also have folks from not just all over the country, but we have some of our members from across the globe that are joining us. I think Philippines and Sweden and a few other places that are already tuned in to us this morning. So thank you for taking the time to share an update from NIDA, and I'll turn it over to you now.
Well, good morning, everyone. And Jessica, thanks very much for giving me the opportunity to speak with all of you, and also importantly for all of your leadership in the Addiction Policy Forum. What I've been told, and I'm very obedient, so I'm going to follow what I've been told, which is to actually give an overview in terms of some of the basic precepts that relate to what the science has taught us about addiction. Again, trying to pinpoint points that are relevant for us because it can guide us on how to do interventions to improve outcomes. And I had stated that I wanted to share my slides, so let me share my screen, and I'll need to know if it's working. So do you see it? Hello?
Yep, we can see it.
Okay, great. So what we know, I mean, there's a lot of work that has been going on both in animals and humans that have actually allowed us to understand why certain drugs can produce addiction, why they are rewarding and produce this sense of pleasure. And very much what all of these drugs have in common is actually that they have the capacity to increase dopamine. And dopamine is a chemical that actually signals information between two neurons in the brain. And in areas, actually, it so happens that this signaling process is very important in brain reward regions. And thus, it's not surprising that anything that produces pleasure can activate this dopaminergic system, but drugs do it artificially. So we have here dopamine is increased. When someone takes a drug, actually that is activated. But what studies have shown as compared to a control condition is when someone has repeatedly taken these drugs, what happens is that the system adapts itself in such a way that there is a decrease in the amount of dopamine that those cells can release. And importantly, also, there are changes in the proteins, in the receptors that are the ones that are going to be carrying this message. So while taking the drug while you're intoxicated may temporarily activate the system, with repeated use, there is adaptation that leads it to be much less functional when you are not under the influence of that drug. And this gives us an understanding on not just about why drugs are rewarding. I mean, there are many other effects, but this is a key component. But also importantly, why people don't feel right. The more they take drugs, that they actually get feel uncomfortable, and with repeated use, they will take the drug actually not even to feel pleasure, but to feel normal. In parallel, there has been a lot of work to try to understand how these changes produced by drugs and the adaptations influence the rest of the brain. Because it's clear that addiction is not just a disease of the reward systems, but actually because those reward systems are crucial and fundamental in modulating many other networks in the brain. It actually has downstream effects that influence not just reward, but also importantly, our emotions. And another very important component of it is our executive processes, which are mediated in our in our brains, predominantly by the frontal cortex, this area of our brains. And executive functions are necessary for abstraction, for making decisions, for carrying it through, for regulating our emotions and our desires. So there is a very complex landscape of changes in the brain produced by drugs that is associated with the behaviors that we see in people that are addicted, this intense desire to take the drug that is driven by processes that involve these reward centers and memory centers, as well as the dysphoria that follows when you are not intoxicated, that involves emotional areas of the brain, limbic areas of the brain, and the disruption of the capacity to self-regulate the intensity of those emotions, desires by the prefrontal cortex. And this delineation of the systems that are involved in addiction is, of course, very important in guiding us in treatment and understand it better. What we know from the science of addiction is that it's not just, we speak about it, a disease of the brain, and it is a disease of the brain, it is a chronic disease of the brain, but it's also clear that it emerges, it doesn't emerge on everyone that get exposed to the drug. And some people are more, do go into developing addiction. Others take drugs during childhood and adolescence, and then young adulthood, and then discontinue it. And in fact, most people discontinue drug taking as they grow older. But approximately what is estimated to be 10% of people go on that have been exposed to drugs go on into becoming addicted. And addicted we define by the process by which someone is compulsively taking the drugs, unable to stop it, even though they want to do so. And they also, this inability to stop their drug taking has had negative consequences in their life. So what is it that drives that phenotype that we call addiction? There are changes in the brain, I just mentioned it. And yes, they are triggered by drugs. But as I say, not everybody has that response. So what we do know is that there are genetics factors that play an important role. We also know that the exposure times of someone to these drugs has an influence such that the younger you get exposed to drugs, the greater the risk of becoming addicted. So neurodevelopment, genetics, heritability, and the environment is crucial. And I think that in terms of what is evident is that social factors are probably extraordinarily important in determining whether this phenotype of addiction emerges or not. And an area of tremendous interest is actually to help us clarify how do genes, so if I have a genetic vulnerability for addiction, what is it doing to the way that I respond to the environment? Because ultimately, the way that genes make you vulnerable is exactly that, by modulating the way that you are responding to an environment. So with research, we're starting to understand how adverse environments make you more vulnerable to addiction, or alternatively, how resilient environments like social support of caring and emotional support can give you resilience. What we know is, yes, indeed, genetics are very important, and they are important because genetics actually help us actually determine how your brain develops. It has an impact on the brain architecture. It's also clear that your environment and the stimulation that you get during development is also crucial for brain architecture. So ultimately, it's a combination of both. And in this study, what researchers are doing is mapping how the architecture of the brain of children 5, 8, 11, 14, and 15 actually changes during those periods. But what percentage of that change is related to heritability? So here in red are the greater the heritability influence on that architecture. And what's very interesting on this study of heritability is that the heritability emerges later on than in the early stages. In other words, effects of genetics appear to have a greater influence as you grow into late adolescence, young adulthood, and highlighting the extraordinary importance of environment during those childhood years. In terms of how the brain develops, there are also other aspects that are very relevant to understanding. Why is it that adolescents are more likely to experiment with drugs and to engage in risky behaviors? And also importantly, why are they more likely to develop addiction if they start taking drugs? And there are many differences between adolescents and adult brains, and one of them is neuroplasticity. Children's and adolescent brains are actually much more influenced by environment, physically changing it and it's changing its function than the adult brain. We continue to have been neuroplastic into adulthood, and that allows us to learn new things and to actually improve in many of our skills. But that is more prominent in adolescents. And that, again, that's why they learn faster. But that's also why if they get exposed to drugs, the changes are longer lasting. Another aspect that is important to highlight when differentiating adults and adolescents as it relates to the risk of risky behaviors is that the brain systems and networks develop at different times. So when you are born, you basically, your brain is not fully developed, but shortly after that, the systems that allow you to, for example, perceive sensations like food or sugar or warmth are actually much more developed at the centers in the brain that are necessary for you to exert abstract thinking. And so first, there is the limbic regions of the brain, as well as primary sensation areas that develop. And later on, the prefrontal cortex and other association cortices that are necessary for high cognitive function and control develop later. And this unbalance is what is making children, adolescents much more impulsive and more likely to actually engage in risky behaviors. We also have known now for many, many years that, that environmental factors, as I mentioned, are crucial. And in particularly adverse childhood experiences have been associated by many researchers, independent laboratories, with greater likelihood of substance use disorders, greater risk. And the greater the number of adverse childhood experiences, as shown in this line here, the greater the risk of developing a substance use disorder. So such that if you, as a child, were exposed to 5 or more, your risks are tenfold higher for a substance use disorder. What are those risks? Emotional, physical, sexual abuse, neglect. Emotional and physical neglect are very devastating for the human brain. Household dysfunction, battered mother, parental separation or divorce, mental illness in household substance abuse, incarcerated household members, poverty. All of these aspects actually are increasing the risk. Now with imaging, we have been able to start to delineate why. And what it is clear, and as I mentioned it already, is that deprivation, whether it is emotional or physical or social, actually endangers the development of the brain because you are not stimulating it. So those systems require stimulation in order to be strengthened. Without it, it doesn't happen. And so, for example, this was noted very early on by imaging studies in children that have been brought up in orphanages, for which there was actually a lot of emotional neglect. And these researchers very early on reported that there was impaired development of connections. And the connections in the brain are crucial because the brain is a network, that extraordinary complex network. And the way that it functions is really by integrating the information for multiple areas of the brain. So these studies show that there was disruption in the connectivity, the formations of those connections, of the wiring of the brain in multiple areas of the brain, including those that are linking limbic areas with prefrontal cortical regions. They further on went to show that the longer the children had been in the orphanage, the worse the impairments in those connections. And more recent studies, like with the ABCD, which is following close to 12,000 children, it has been possible by many others to now document that effectively children born, even if it's not in an orphanage, but in areas of neighborhood deprivation, where they actually are subjected to less likelihood of parental supervision or social activities, actually have a decreased development that basically affects the development of the prefrontal areas of the brain. And again, this is important because whereas with genetics at this point, we do not know how to modify one's risks. What we do know is how to actually improve the social interactions of children and adolescents. And this is a target actually for prevention interventions. And by having now this ability to monitor the changes in the brain, we can actually see how these interventions can help remediate those disruptions in brain development that are occurring during this time in our lives, which is very susceptible to environmental effects, but also that gives us an opportunity to do effective interventions because the brain is more neuroplastic. And thus, I mean, what prevention research has shown is that they are all of these things that are producing risks that are basically, whether it's at the individual, family, peer, school, or community, have basically risk behaviors need to be addressed so that they are decreased while we enhance protective effects. That's what prevention does. How do we enhance protective effects? Taking advantage of the multiple layers that can be used to intervene, as I say, from the individual to the community to give those children and adolescents the greater likelihood of success. We have also learned that whereas drugs do change the brain actually in long-lasting ways, they can be treated and that the brain can recover. And one of the areas that people always ask is, does it recover completely? And the answer is, there is significant variability, but just like in other areas of medicine where we can see that individuals can recover from a stroke, we're also observing that the human brain can recover. And so our understanding about interventions that can maximize and accelerate that process is crucial, again, to ensure that patients are more likely to achieve recovery. There's a lot of work that has been done to understand and to provide evidence about what treatments are more effective for the various substance use disorders. In this respect, there are both evidence of behavioral and pharmacological therapeutics that improve outcomes. Therapeutic interventions can be extraordinarily valuable in helping people achieve recovery. Unfortunately, we only have FDA-approved medications for 3 substance use disorders: nicotine addiction, alcohol use disorder, and opioid use disorders. And in the case, for example, of opioid use disorder, methadone, naltrexone, buprenorphine, these 3 medications are very effective, not just in reducing craving and withdrawal and the illicit use of substances, but importantly, in preventing negative outcomes, including being very effective in preventing overdoses and deaths. And similarly, medications for alcohol use disorder actually are quite effective in helping people achieve remission. There is variability. Some people respond better than others, and thus research is going on to try to understand how we personalize the interventions. Of behavioral treatment, there are actually multiple modalities that have been shown to help in the improvement in recovery, of which one of the ones that has the largest effects is contingency management with or without community support systems. And again, at the basis of this strategy, as well as even some of the interventions that rely on group therapeutics like Alcoholics Anonymous or Narcotics Anonymous, rely in providing alternative reinforcers in order for people to be able to actually help them stop taking drugs. And of the reinforcers, one of the most powerful are social, meaningful reinforcing stimuli. There's a lot of research to try to actually expand access to therapeutics for substance use disorders in general. For example, in the case of opioids and methamphetamine and cocaine, we're very interested on first of all, the urgency of addressing what's going on, but we're very interested on the use of immunotherapies, just like we use for COVID, that can be used to, for example, whereas this is someone that takes that drug is absorbed into the blood, and from the blood it goes into the brain where it activates the proteins and receptors in reward regions producing the high, or in respiratory centers producing respiratory depression and overdoses with opioids. If you get immunotherapies, whether it's monoclonal antibodies or vaccines, the idea is you produce these antibodies that are basically antibodies against the drug. It can be antibodies against methamphetamine or cocaine or fentanyl. such that when someone is vaccinated or has received these immunizations, when they take the drugs, the antibodies trap it in the blood and it cannot get into the brain. So you prevent the effect. So that's one of the strategies. There's also a lot of work, extremely exciting, to actually use different types of neuromodulation technologies whether it is delivery of magnetic pulses or electrical pulses or ultrasound pulses in areas that have been defined as engaged in addiction. As we mentioned, two key ones are prefrontal regions. So if you stimulate them with these neuromodulation technologies to enhance executive function, but also target limbic regions that are sensitized and that are leading to negative emotion, to inhibit them in such a way that they can actually help the person stop the strong urges and craving for the drugs. So neuromodulation technologies have shown to be very promising for the treatment of multiple substance use disorders. And I just want to end with a few slides to actually highlight a point that is crucial, that has been made even more clear that by the COVID pandemic. And the COVID pandemic has actually shown how devastating a stressor can be in an individual's life, particularly if they do have a substance use disorder or a mental illness. And we have seen during the COVID pandemic, as one would have expected for the exposures of stressors, that it has increased the overdose mortalities in our country at pretty dramatic levels, at levels that we have never seen before, as it relates to overdoses, acute overdoses. And this is data just to showing for the 12-month period that ended in March 2021, which is 12 months of COVID pandemic, there was what appears to be a 23,000 increase of people dying that year from overdoses. A total of 31% increase on when we were already in 2020 at the end of March at very high levels, the highest we've ever seen. Multiple factors are accounting for this increase in overdoses, and that includes, very importantly, the stressors from the pandemic, and as well as the changes in structural systems that have made it much harder for individuals that have a substance use disorder to access the support and treatment that they need. That's clear. It's also clear that synthetic opioids like fentanyl, as well as psychostimulant drugs, particularly synthetic psychostimulants, methamphetamine, have become much more accessible. And that has been a horrible combination that has led to this enormous amount of mortality. But I want to ponder on this point, because I think that this is, if there is a message that I want to leave you all with, is this one. I mean, a drug use may start by curiosity because of peer pressure, because initially that's sort of actually an occasional use. It may be rewarding. But when people become addicted, it is far from pleasant. People actually take the drug in order not to feel so bad. And they are trying to escape a reality that is also very difficult to contend with. And this is an example, this picture, actually, I think it illustrates this in a way that I think no words can say. So addiction is not something that someone seeks for the pleasure of it. It's someone that basically people feel in a way they have no other choice. And it is linked with a horrible isolation. And this isolation is driven both by the stigma and discrimination that exists against people with substance use disorder, but also about the self-stigma imposed by people who have a substance use disorder, as they themselves start to actually stigmatize their own sense of value. And this isolation actually makes things much worse, because as social creatures, we rely very much in others for social reinforcement and well-being. And I like to show this, how important it is, because with this very elemental model that is done in rodents, one can see how important social interactions are if we are not aware, which basically, if you give an animal an opportunity to get either a social reward or heroin, or the same thing with methamphetamine, the animal will not choose heroin. They will choose the social reward. On the other hand, if you penalize that social reward, and you can do it in several ways, you can see then If the social reward is penalized, people take drugs. And I think this is the message to me. When we discriminate, when we stigmatize, we're penalizing social interactions. And actually, instead of having a protective effect from taking the drug, stigmatization of social relations make that person much more vulnerable to drug taking. So in our hands, we have one of the most powerful tools, meaningful social interactions, most powerful tools in preventing substance use, most powerful tools in helping people who have a substance use disorder. If we turn them around, we also have in our hands one of the most impactful negative consequences, negative influences that can lead a person to drug taking and to relapse if they are aiming to stop taking. So my message is, yes, we know a lot about the science, about ultimately what drugs do to the human brain. And we're coming to learn actually that many of those neurobiological systems are crucial and fundamental to actually sustaining social relationships and benefiting from them. Thanks very much for your attention.
Thank you so much, Dr. Volkow, for covering so much ground. It's so helpful. We're so grateful that you talked about risk and protective factors and prevention, genetics, into sort of the COVID SUD head-on collision that I think we're all still trying to make heads or tails of. A couple items, and we're also fielding questions from our network and our participants. We have one question that came in about, can you speak to how mental health issues and substance use disorders play out in the brain?
Yeah, and it's a key and very good question ultimately, because what we have seen is this actually when someone, in people with substance use disorders, is much more frequent that you see comorbidity with psychiatric illnesses, in particularly depression and anxiety. And so the question has always been, well, is it because you are taking drugs because you have these depression and anxiety, so you're trying to auto-medicate? And that is possible in some instances, absolutely. There's evidence to that, but there's also evidence to show that repeated drug use can make you much more vulnerable to depression and to anxiety. So that directionality goes both ways. So in terms of what is the implication of that for prevention is that early detection of mental illness is probably a very important one to initiate treatment and to prevent someone from going into a substance use disorder. And second, that for treatment of substance use disorder, it is crucial that there be screening for a concomitant an associated mental illness such that it can be treated. Because if you don't treat it, your likelihood of succeeding in achieving recovery is much lower. And this is also even very relevant. I think about it a lot as we're dealing with the issue of the overdoses. I mean, sort of the question is to what extent some of those overdoses are really intentional, how fully intentional they are. I mean, in some instances, there may be. I mean, sort of the person takes the overdoses because they want to end their lives. In some other cases, they really don't care if they wake up or not. But understanding that there may be an underlying mood disorder is necessary to prevent these overdoses from happening again. So regardless, it is crucial that we provide with support systems that will enable in individuals with a substance use disorder to be screened and to be properly treated for any other comorbid psychiatric disorder.
Thank you so much. So important, that early screening, early intervention for mental illness as well as SUD. We're getting lots of kudos. Lots of requests for your slide deck and a recording of the presentation. Many thank yous coming in for you, Nora, on the Q&A. A couple other just general thoughts, and we're always so excited to have our annual update from you at our conference. Other things that are happening that make you hopeful, and whether it's new medications, new treatments, new things that are happening in your space that you would like to share with our network? And similarly, what would be the list of things that keep you up at night at the same time? Things that you're worried about or barriers that we should all be aware of and trying to partner to tackle those?
Yeah, things that are making me very excited and really optimistic. And in general, I think I am an optimistic person. I choose to be optimistic in any case. Is having actually, in amidst all of this tragedy that we've seen with COVID, have seen how science can come up with solutions. It has been, to me, quite extraordinary to see how within 1 year we have very effective vaccines that could be utilized for a new, a new virus as it relates to affecting humans. And that epitomizes something that we've observed with the pandemic, and is people coming together. And that notion that we can solve extraordinary complex problems, provided that we all have a common mission, has been made so very clear by the COVID pandemic. And there has been, I guess, we had seen already a change in the perception of addiction and recognition that it was something that we couldn't neglect before the COVID pandemic, as was pushed by the fact that people were seeing how the cost associated with untreated addiction. That was sort of, that attention was shifted with COVID. And now that we are seeing a stabilization of the pandemic, we're seeing again the awareness that substance use disorder, as well as mental illness, is something that we need to prioritize. And that whereas we are going to be able to contain at one level the pandemic, these issues related to the consequences on substance use disorder or mental illness are going to be staying behind and may actually get exacerbated by components, economic issues, by the loss of loved ones, that the after effects of the pandemic, and that we need to contend them. And I think that the will of people recognizing that this is important is something that makes me very hopeful in parallel with advances in science, which actually, as I mentioned, for example, in terms of where we are going, the research on our potential of using neuromodulation to maximize interventions, I think is very important. Very excited about what the big studies that we are doing on development of the brain in children and adolescents is telling us, because it's guiding us how to optimally not just do universal preventions, but start to do tailored prevention, personalized preventions. I think that that's another extraordinary area. So there are multiple fascinating areas of science. What worries me, though, is the same thing, that the same experience that makes me hopeful is also worries me, because it's just sort of like in looking again at the COVID pandemic, you have these extraordinary scientific solutions, and yet at the same time, we're seeing the challenges on implementing them. And the same thing is something that we've been seeing with the substance use disorder field. And I keep on saying it, we have shown evidence, scientific evidence, that treatment works, that prevention works. And yet we are not implementing it. So there's this disconnect. So that disconnect, even though I've seen how marvelous interactions and partnerships can be, as you move through, you have always that challenge of disconnect. And that's what keeps me awake, as well as the continued stigma that still exists in addiction. We are advances, but addiction is still terribly stigmatized. And if we do not overcome that, it's always going to be, we're always going to be swimming against the current. So we need to remove the stigma. We need to actually bring it forward as a condition to which anyone is vulnerable. For different circumstances, some people have sort of more protection than others, but that's not something that we choose.
Well, thank you for that, Nora. I think it's so important that you you talk about so often, and some of your blog posts on this topic of addressing the stigma around addiction and sort of how damaging that is for our patients and how tough it can be to tackle the stigma at the same time. One of the things, and we have a segment from you from a previous webinar where you talk about explaining addiction as a health condition, just as a sort of a simple metric of how much progress we're making on addressing SUD stigma, is trying to get more of the public and more of our community to understand that addiction is a health condition that is treatable and treatable by physicians, and you can recover. We just did a study with the state of North Dakota, I believe last week, which was exciting. But we saw over 3 years a real change in the percentage of North Dakotans who were seeing and recognizing addiction as a health condition. So I'd love for you to comment on that. How do we do a better job of people understanding addiction to be something that exists in the health sphere, that there are physicians and experts and researchers and providers that you can seek, and that this is a chronic health condition like others that we've made a lot of advancements about? Any thoughts on the next steps there?
Yeah, no, and there is a whole area of research in understanding what interventions are most effective in removing stigma. And what it is clear is that the opportunity for people to interact and to understand a condition is crucial to help remove stigma. It's much easier when you're actually for a stigmatized situation or a stigma medical condition. It helps enormously if you have a treatment that shows that it works. And so to the extent that we can, that's one of the reasons why I'm so basically one of our priorities is focused very much on delivering treatments, because it would help everyone. It will help the persons, but it will also have a tremendous impact in removing the stigma associated with it. And I think that this is, for example, very clear with HIV. The moment that you can see that there are treatment interventions and you understand the disease process, that help enormously. And so, yes, in the providing that knowledge and education so people can understand what addiction is. I think that it's not just saying addiction is a disease of the brain, but giving them an insight about why is it that disruption of specific areas of the brain can lead to loss of control, or can lead to this intense craving, or to this dysphoria and irritability, the inability to stop, to impulsive behaviors, giving people an understanding and provide that understanding in ways that are experiential as opposed to theoretical. So to the extent that we can merge that scientific knowledge with opportunity for people themselves who have actually been able to go, that have been in addiction and can share those experiences, that blending of the science and the experiential richness that people can bring by sharing their lives is very powerful. And I think that's sort of actually increasingly more important in our awareness, that we require a partnership between the science, the clinical world, and the patients and their families.
That's so helpful. Thank you, Nora. We have a question that's come in from Michelle. In terms of brain recovery, are there specific factors that increase the potential for healing?
Well, we're trying to study that. I mean, there's an enormous amount of interest. Unfortunately, all of this, the research is still very, very much as it relates to substance use disorder in animal models with respect to what is it that improves the strengthening of the brain, the formation of new synapses. That is from the perspective of therapeutic interventions or medications. What we are learning, though, that more relevant, I think, in terms of where we are for something that could be deployed is in children, for example, or adolescents, exposing them to challenging, rich environments promotes neuroplasticity, just like we see with people that suffer strokes. the target is to engage them in activity. So if the stroke is basically interfering with the motion of their left hand, you do an intervention to actually force them to